Thank you and good evening to everybody. I'm now going to share my screen so that we can start the training for this evening. Just to note that this training session has already taken place during both a morning and an evening session on the Knowledge Hub. Let me just confirm that I am actually sharing my screen. There we go. Has taken place on in a morning and an afternoon session on the Knowledge Hub. So this training is just really to ensure that we also get some footprints in training our private sector healthcare workers. So we're very happy that you have joined this evening. I'm going to start with an overview of the COVID-19 vaccine implementation updates and starting with our presenters and panelists that will be presenting today or who have contributed to the development of this training material. So we have Dr. Itzani from the DG Murray Trust, that also assisted with the development of the material. And then at the National Department of Health, we have Dr. Leslie Bamford, Dr. Shada Ashmal, and then from Sefako Makgato Health Sciences University and SAVIC, we have Dr. Sophie. Then we have Dr. Teresa from DGMT, and then from SCTA, we have Mr. Rabuta, Mr. Stuart Murray, and Mr. Yash, all of them from the SCTA, which is an NGO supporting the National Department of Health for technical support. And then in terms of other panelists from the National Department of Health, we have Mrs. Alka Larkin, who is supporting the EVDS program implementation. From Right to Care, we have Mrs. Brenda Goldblatt, then myself from the National Department of Health. We also have Monsonique Buerta from SCTA support as a technical support for SVS. Then we have Mpo also as a technical support for SVS. And then we have Mrs. Nombulelu Leburu, who is the Director for External Communications at the National Department of Health. We also have Pietro Rousseau from the National Department of Health, Technical Advisor for the MFL and EVDS. We have Mrs. Sue Patter, who is also from SCTA as a technical support. And then we have Professor Hanneli Meyer. So actually, Professor Hanneli Meyer won't be attending the trainings, but have contributed to the development. And in the trainings that we did on the Knowledge Hub, she did actually present on vaccine safety as the chair of the National Immunization Safety Expert Committee, but she's unavailable this week. And then from SAVIC, we also have Professor Rose Bennett. So I just want to, in advance, thank all of our presenters. You can see their contact details. If you have any specific questions which you would like to ask after the training, you're welcome to contact any of them. I'm going to ask Dr. Lesego to please close the chat. And then if you have any questions that you would like to type, please use the Q&A. So that the panelists can start answering questions as we move through the presentations. There will be a question and answer session for live questions and answers at the end of the presentation. But if you have any question, you can post those questions in the Q&A. So just to give you an update, we recently launched the vaccine implementation guide, and it is available on the Knowledge Hub. I have posted a link in the Knowledge Hub to the document, but I think it's useful for us to understand how to use the implementation guide and the compendium of guidelines, tools, and additional information that is linked to the guide. So the guide has 9 chapters, starting with an introduction, then planning and mechanisms of vaccine service delivery, then vaccination site setup and management, and advocacy, communication, social mobilization, and activities. During the presentation that we'll do today, we are combining some of these chapters to give a brief overview. Followed by chapter 5, which describes the training platform for healthcare workers in the COVID-19 vaccination program, and noting that there's a vaccinated training that's available on the Knowledge Hub, which is a requirement for the Section 22A15 permit, which is issued to facilities. Then in chapter 6, we discuss effective vaccine management, culture, and logistics. Chapter 7 is the planning the client journey and the administration of COVID-19 vaccines. And that we will cover tomorrow, also including how to use EVDS throughout the process. And lastly, tomorrow we will cover vaccine safety surveillance. However, today we will cover monitoring and evaluation. And again, you can see the link to the Knowledge Hub if you wanted to download either the document, the guideline, or if you would like to download any of the relevant SOPs or circulars that have been shared with either the private and public sector. So how do you use this implementation guide? The implementation guide has specific icons, which you can see here on the left. And these specific icons illustrates what you are working with, if there's a link or a URL, if there's an annexure attached, or if we're referring to the MFL, or if we're referring to a vaccine champion, or if we're referring to a vaccinator. So each of the different chapters within the guide is useful to the vaccination program as a whole, but maybe not as useful to all of the role players within the vaccination program. And therefore, at the beginning of each chapter, there's an indication that who this chapter might be most suitable for. And at the end of the chapter, there's a summary, key messages from that chapter. So if this specific chapter is not relevant to you as a service delivery site manager, and you just want to read the overview, you could read that over there. And then at the end of the document, we have a list of annexures. And if you hover with your mouse over the web version of this document and you click on the link, it will take you to where the document is stored on the Knowledge Hub, where you can download that document. Also, if you see any of these annexure icons throughout the chapters, and you might see these links that you can also click on, and it will take you to the SOP or to the relevant reference document that we are referring to in this specific section. So the first chapter that we are going to start with is vaccination site selection and management. This will be presented by Mrs. Patter. I just want to note before we start, I see 5 hands are raised. Can I please ask that you rather type your question in the Q&A, and at the end of the presentation, we'll give an opportunity to take live questions. Thank you. Sue, if you're ready, you can start.
Thanks, Marion, and good afternoon, everybody. As Marion mentioned, I will be just providing some highlights from chapters 2 and chapters 3 of the guide, focusing mainly on vaccination site selection and management. And I'll be looking at the site topology, which has been introduced and implemented in terms of the vaccine rollout, to focus a little bit on the master facility list, as well as the process for registering to be a vaccination site and applying for a Section 22A15 permit. And then 2 aspects of the vaccination site process, which have become more important as the process has matured, focusing mainly on site monitoring and compliance with minimum standards, and then site deactivation and closure. If we go to the next slide, please. So in the early days of the vaccination program, there was an enormous amount of energy went into figuring out the different types of vaccination sites and where vaccines would be administered. Because as you will all remember, there was an enormous challenge in terms of getting large numbers of the population vaccinated as quickly as possible, using a wide variety of vaccinators and in various settings. So eventually the team came up with a site topology, which is based on a parent site, which is always a health establishment, and various types of outreach services where the service is provided from the primary site. So it's been important throughout the rollout to figure out what does the service delivery model look like before one embarks on providing vaccination services. If we go to the next slide, we're just going to have a bit of a reminder on the different types of outreach services. In the early days of the program, there was a lot of emphasis on fixed outreach services, which are not health establishments. And these sites were set up, for example, at the Cape Town ICC, at a Discovery head office in Sandton, on a semi-permanent basis. And they were equipped with the required equipment, and they were able, and they still are able, to store vaccines overnight. So these sites do need to have, they need to be linked to a primary site. And not all of these community sites are on the MFL and need to be added manually. And they do require their own Section 22A permit. And they cannot host outreach sites. So it's important that the outreach sites have to be linked to a health establishment. The second type of outreach site is a temporary outreach site, and that is, as the program has matured, has really proven to be a very, very useful model of delivery, where vaccination services are provided on a temporary basis. They don't store vaccines overnight, but they're linked to a primary vaccination site. So as one has seen over time, the various pop-up temporary sites which have popped up during the vaccine rollout, these are all temporary outreach sites, and they are added to the MFL by the relative facility rep, and vaccination services are not activated. And importantly, they don't require their own permit because they operate under the auspices of the permit issued to the primary vaccination site. And then the last variety is mobile services, which are used widely in rural areas, where the site doesn't store vaccines overnight, and a team of vaccinators moves from place to place, providing vaccination services. Again, it's linked to a primary vaccination site, and vaccines are not stored overnight at these sites, and they also operate under the primary site's permit. If we go to the next slide, please. So this model has actually worked rather well, and it's been possible for a large number of people to be vaccinated very quickly. One of the foundations of the site topology is the master facility list, which has really come into its own during the vaccine rollout, where it's providing a complete authoritative list of facilities in the country offering health services. So the MFL is actually now providing the master data relating to health facilities in the country. And this relies on the definition of health establishment provided in the National Health Act, which is provided on the slide. I won't go into the detail of it. I think what's one of the important learnings from the vaccine rollout is the need for really good master data relating to facilities and where health services are provided, that can then be exchanged across systems. It can be used on various other IT systems which support the provision of health services. And it's really been helpful to use the MFL to keep a list of health facilities that are approved to administer the vaccines. I think as we go into NHI, the MFL is really, really going to come into its own, and the lessons learned from the vaccine rollout will be very beneficial and will be applied. If we go to the next slide, we've included here as a reminder, because this will be important not only for the vaccination rollout, but also as we move forward in using the MFL, the various roles or user profiles which appear on the master facility list. Very importantly, for private sector organizations, each organization identifies an MFL coordinator who actually then serves as a focal person for the MFL between that organization or province and the National Department of Health. So, for example, a large hospital group or a group practice would have an MFL coordinator who then is that liaison between the MFL and the organization and the department. At facility level, there's an MFL facility representative who's responsible for editing and adding facility details and maintaining the data on the MFL for that particular facility. There's also a curator who needs to understand a particular facility well enough to be able to review and confirm that the data captured by the site is correct. And then there are two important roles which are at the National Department of Health, which are then the systems administrator and the MFL approver. And the systems administrator reviews and approves online requests, with the MFL approver giving final approval for any edit or change or addition on the MFL. And then importantly, too, provision is made for external systems representatives who are users who can represent an organization that needs API access for one or more of the electronic systems to link onto the MFL. And this was very successfully used during the vaccine rollout, where it was possible, for example, to import large chunks of data onto the MFL via API. If we go to the next slide, we've just included some of the process flows, and I'm not going to go into a lot of detail about them, to just for reference really for people on the webinar to be able to go back later on and just to understand how the process works, particularly for the MFL facility representative and the curator, in terms of the process which is followed in order to get a site onto the MFL and then to activate a vaccination service on the MFL if that site is going to be providing vaccination services, because that's the mechanism whereby there's a link then into the EVDS where the vaccines are actually captured by the vaccinators, and we'll be going into that in one of the later sessions. If we go to the next slide, that's then explaining the role of the curator, who's then the person at facility level who can agree and approve whether the details added onto the database are in fact correct for that particular facility. If we move to the next slide, I just wanted to focus on the bottom part of this diagram, because one of the key principles of the vaccination rollout has been that any site that wants to function as a primary vaccination site needs to hold a Section 22A15 permit. This permit is issued by the Director General of the Department of Health in terms of the Medicines Act, and enables a person or organization to acquire, possess, use, and supply any medicine. And this was the mechanism that was used to manage the vaccine rollout and ensure adherence to conditions of the permits that were subsequently issued. So once a facility is successfully on the MFL, they have been curated, they have activated vaccine services, then the system is hosted by the South African Pharmacy Council, although permits are issued by the department, and an electronic token or link is sent to that facility, and a contact person is then responsible for completing the application to indicate whether the facility is able to comply with the conditions of the permit. The application is considered by the National Department of Health in collaboration with the Pharmacy Council, and eventually the permit would be issued. So that process is underway, and the last I heard, we had there were in excess of 5,000 permits in system and in play across the country. If we go to the next slide, I just wanted to spend a little bit of time focusing on the different phases of the vaccination site process. So the first step really identified in the relevant chapter in the manual is that the first step is to identify the site, where are vaccine services going to be provided. The site is then activated, and that goes through the process, the MFL processes and the permit processes, as we have just highlighted. The site is prepared and set up with all the staff and the equipment and so on. The site goes live, and then obviously it operates. There's a maintenance phase where the site is maintained. Site monitoring is important, and then once that population no longer requires that service, then sites are being deactivated and closed. So for the purposes of this presentation, we thought it would be helpful to focus mainly on site monitoring and site deactivation and closure, because we're seeing that sites are reducing, and there is a process underway at the moment to integrate COVID-19 vaccination services into mainstream services as well. But obviously the standards that have been set up will apply. So if we just focus a little on site monitoring, we've included in the manual the different types of site monitoring visits that can take place. There obviously needs to be internal monitoring of the site by the vaccination site manager, and it's recommended that this is done on a twice daily basis. There's also provision made for district teams, observer teams, or any other competent authority, which could be, for example, a Professional Health Council, the South African Pharmacy Council, the Health Professions Council, SAPRA, the South African Health Products Regulatory Authority. They also have the competence in terms of legislation to monitor the vaccination sites, to provide oversight and improve the process. And importantly, assessments can be done to investigate allegations of misconduct. And there have been a number of instances in recent times where various allegations of misconduct have come to light and have been investigated using this method. What has also been done is, as anyone who's looked at the guide will see, that there's an enormous amount of information in the guide, as well as in the toolkits and the various SOPs and job aids and circulars. So what the team did was put together a set of minimum standards for COVID-19 vaccination sites and the provision of vaccination services, so that anybody who embarks on providing services knows that this is the absolute minimum that has to be followed. These are the minimum standards that have to be followed. So these standards are applicable to all kinds of vaccination sites, whether they're primary vaccination sites or the 3 types of outreach services that we referred to at the beginning of this part of the presentation. Obviously, if it's a site which doesn't store vaccines, then the provisions around storage of vaccines, for example, in fridges and so on, would not apply. But obviously, the maintenance of the cold chain in the cooler bags would apply. So, you know, the standards are flagged in terms of where they're not applicable to a particular site. And very importantly, the permits can be withdrawn or suspended by the Director General if there is found that there is non-compliance with the conditions of the permit. If we go to the next slide, we also thought it was important to focus a little on the suspension or withdrawal of permits. So as I mentioned earlier, if there is non-compliance of some kind, the permits can be suspended or withdrawn. And there have been instances in recent times where permits have been suspended. The permit holder, the organization who holds that permit, has to make sure that there's compliance with the conditions of the permit. The permits were all issued for a period of 2 years, unless withdrawn by the Director General. And the department will have a look at this whole process 2 years on from the issuing of the first permits. As I've mentioned before, a valid permit can be suspended by the Director General or the office of some officer in the Department of Health to whom this function has been delegated. And vaccination and distribution services may not be provided by or from a vaccination site if the permit has been suspended. And it's not possible to reapply for a permit for the same premises during the period of suspension. There is, however, provision made in the Medicines Act, which does apply in this instance. So if a permit has been suspended or withdrawn, the permit holder may appeal that decision to the DG in terms of Section 24 of the Medicines Act. What's important also is that if the permit is suspended or withdrawn, then that vaccination site is removed from the EVDS. So vaccinators will no longer be able to register vaccines administered against that particular site. If we move then to the last slide in this section, we also thought it important to focus a little on site deactivation and closure. If a site is being decommissioned because there's no longer demand in that particular area for that service, the public importantly needs to know if that site needs to close and to ensure that community members have received their vaccinations. I know a number of members of the public have gone happily off to go and get a vaccine to find that, oopsie, the service is no longer being provided at this vaccination site. The vaccine service needs to be deactivated on the MFL. So if the organization or department wants to close a facility because it no longer exists or it's a duplicate, then the MFL facility rep needs to go to the MFL and deactivate the facility. If it's only deactivating a vaccine service, they only deactivate the service. They leave the site, the facility, they leave it on the MFL because they're still providing other services. Scheduling on the EVDS is deactivated. And very importantly, on the stock visibility system, which we'll talk about later in the presentations, that site needs to be deactivated on SVS. And importantly, the stock on hand must be 0. If there's still a vaccine stock sitting there, then it cannot be removed. That site cannot be removed from SVS. And very importantly, clients do need to be redirected to alternate vaccination sites. Go to the last slide. And this slide is just providing a little bit more detail in terms of deactivation of sites on the stock visibility system, a system which has been used successfully in the public sector to monitor availability of medicines, with a special instance of the system being developed and implemented to monitor availability of vaccines. And we'll get into the detail of that a little bit later on. So importantly, when there's a deactivation, the stock on hand must be 0, and a request must be approved by the relevant person within the public sector or private group. We've had a couple of instances where vaccine sites wanted to be deactivated, but actually their head office didn't know that they were busy being deactivated. So it's important that it does come from a head office if it's an organization. So those are just some of the highlights of Chapter 2 and Chapter 3, which we've included here for purposes of this presentation. Obviously, there's a lot more in the manual, so you're welcome to put your questions into the Q&A, and we'll respond to them as we go on through the evening. Thanks, Marion, back to you.
Thank you very much, Sue. We're going to go to advocacy, communication, social mobilization activities, and Mrs. Brenda Goldblatt from Right to Care will be presenting these slides for us. Thank you, Brenda. When you're ready, you can start.
Okay, good evening, everybody. Thanks for the opportunity. I'm actually presenting the very good slides made by Professor Hunley. And so let me go on. So I think the objective here is to, sorry, I've got COVID, is to give you up-to-date information on COVID advocacy, communication, and social mobilization strategies, so that you can promote the vaccine with confidence and increase public confidence and acceptance of the vaccine. Okay. Next one, please. Okay, so obviously as healthcare professionals, you are the most critical, trusted source of information to the public. And so hopefully this module will help you to deliver a clear, consistent, and concise message to build trust. Very important that you excuse me, speak with a trusted and confident voice, that you give facts about the vaccination and dispel myths, that your message is is inclusive and doesn't exclude or prioritize anyone, that all 12 years and up are encouraged to vaccinate, and that the primary message is that vaccination offers the best protection against severe illness and death as a result of COVID-19. And that to encourage people who are vaccinated to share their vaccination stories and spread the good news. And I think obviously that we also encourage people to have all the vaccines that they're eligible for. Okay, next please. Okay, so despite the huge success of the vaccine, we all know that there's a lot of work to do and that currently what we're experiencing is an increase in vaccine hesitancy, which means we've seen a downward trend in vaccination take-up since last year, especially since December, and that there's a very, very strong anti-vaccine community in South Africa who use every opportunity, especially on social media, to spread misinformation and discredit vaccines. I think what's very important is to understand vaccine hesitancy and how you should respond to vaccine hesitancy in practice. As you can see here, vaccine hesitancy is dynamic. It goes from delaying vaccination to refusing vaccination, even when their services are available. So vaccine hesitancy is influenced by factors such as confidence in the safety, the system, and the policymakers, complacency, where there's a perceived low risk of acquiring COVID-19, and convenience, which includes availability, accessibility, and that you can get the service in an appropriate language. So most vaccine hesitant people are in the middle of the spectrum, so they're delaying rather than refusing. So our aim is to move that person who refuses from the right-hand side of the spectrum, which is they're saying no, to the left-hand side where they'll say, I'm ready to get the vaccine. So if we look at some practical examples within the vaccine hesitancy spectrum and how you can respond. So we'll come across people who'll accept the vaccine by saying, for example, okay, I guess I'll vaccinate, but they're unsure. So with those people, best is to offer them positive encouragement and support that their decision is the perfect choice. The next group will be in the middle of the spectrum. They're not against vaccines in principle. They accept the vaccine, but they're not ready to have it. They've got doubts. Best is to respond with real empathy and have a discussion to understand their questions and concerns and answer with confidence. The last group are the people who absolutely refuse, but they're unsure about their decision. Never dismiss them from the facility. In your response, you need to focus on their concerns, show respect, don't argue, but rather direct them towards trusted community members and sources of information. Next slide, please. I think that's just to everything. Thanks. So in addition to being able to promote vaccination with confidence, you should also understand that the way you initiate the conversation can influence people's decision. So what we're looking at is the difference between a participatory approach on the left and a presumptive approach on the right. Researchers found that a presumptive approach works better than a participatory approach. So never use the participatory approach when you invite people to consider whether or not they want to hear about the COVID vaccine, or whether they want to vaccinate, because it increases hesitancy and it gives the impression that you, who's the responsible communicator, isn't confident. So what a participatory approach would be, would you like to hear about the COVID vaccines that we offer? The presumptive approach is, today you're due for your chronic medication, we'll give you the COVID vaccine as well. Or it's time for your COVID-19 booster. Your child is old enough to receive the vaccine. So if you presume that the person is going to have the vaccine, they're more likely to accept the vaccine. And this research has shown is a far better approach. Let's look at slide 6. So in all our public and health education, and specifically COVID, surveys have shown the importance of targeted messages towards specific populations, which considers their age groups, their social norms, the social context, and what the vaccination take-up is in that particular group. So our highest take-up is in the 60-plus age group. So when we're speaking to them, the priority should be to emphasize the importance of getting a booster, as it provides added protection to keep them healthy and out of hospital. And where do we do it? This should be done where the over 60s are most likely to gather: community hubs, community clubs, and of course, clinics when they're there. For the 50 to 59-year-olds over here, at the moment, we've also had relatively high take-up. And so a lot of the information should be supporting boosters and to make sure, obviously, people have had their second shots. And we should be encouraging people to get the vaccine before winter sets in and the fifth wave really takes off to protect them. So when it comes to younger age groups, the strategy should be slightly different. For 35 to 49, we should be targeting workplaces and community hubs and build our messages around vaccination ahead of the fifth wave to keep them and their families healthy. because obviously among that age group over here, the 35 to 49s, we have seen a big drop off, and also Omicron is really not regarded as much as a threat as Delta was. And so we should be pushing the fifth wave. For the younger groups, where do you find them? It's wherever they gather and socialize, offline and online. We know they're the least affected by COVID-19. So the message should be that vaccines reduce your chance of the negative impact of long COVID, which we do know young people have experienced. And finally, for the immunocompromised, the importance of an additional dose to provide protection is really important. And also one of the things, unfortunately, that we found in recent research is that people living with chronic diseases are no more likely to vaccinate than other people in the same age group. And so we've got a real job of work to do to give people with chronic diseases the confidence that the vaccines are safe for them and their condition, that they are safe with the drugs that they're taking, and that research has shown that they are no more susceptible to severe side effects than anybody else, because those three things seem to be the main concerns. Next one, please. Next slide. So one of the things that that we'd like to make you aware of is what is already going on in the vaccine communication space. Hopefully people on this call have heard of Keredi, which is it's a very, very big campaign that's been run under the auspices of the Department of Health and the DG Murray Trust. And it's been focused on 12 to 34-year-olds. And it's got a very, very clear, simple message, which is, let's get back to our lives and vaccinate. It's very aspirational. It's mostly using young people who are living their best lives. Each one's a real different narrative of young people. It's got a strong call to action, which is always, whatever I'm doing, but I'm fully vaxxed, I'm ready. It's been widely distributed on social media. Very importantly, it's had some young doctors working on the campaign. And these young doctors have had tens of thousands of questions about vaccine, which they've answered. They've run a competition with content generated by young people about the vaccine. They've worked very closely with young people to develop the content, and they're doing more and more outreach to youth venues. And Keredi is transforming, and I think is going to launch with a whole lot of new messaging very shortly. But we have found there's been research that says about 250,000 young people who would not have vaccinated have probably vaccinated because of exposure to Keredi. Next slide, please. This just gives you an idea of Keredi. Let's just show this video to show it's very inclusive. Go for it. I don't know if you've got sound.
Yeah, to share the sound, you need to reshare and click on the share sound tabs. Yeah,
okay. Well, what I'd like to say is that if anybody on this call is interested in the Keredi content or would like to share it yourselves in any of your networks, you can find it online at zwakala.za, on Facebook, on SA Coronavirus, or just via Mariana, just drop a line and we can link you to this. And it really has been made for anybody who's in communication around COVID to share. Okay, let's look at the next one. We've done that. Let's go to the next one. So a lot of the messaging targeting 35 to 49-year-olds produced by the Department of Health has really focused on keeping families safe. there was a big impetus to drive communication around Easter and to use that as an opportunity, because of course we all gather and think about our families. So what the department's been doing is producing fact-driven content, position in religion and science. It's been very much focused on media platforms, primarily Facebook, Twitter. It's contextually positioned content, and it's community dialogue and outreach driven. It reaches target groupings through social mobilization and civil society, including Contralesa and other organizations. And it also has behind it a panel of health professionals who provide facts and bust the myths around COVID-19 vaccines. Let's go to the next one. And then also just to make you aware of another campaign that's just coming to an end. We'll just have to read this.
Marion, try unmuting. Thanks.
So obviously that one is targeted at young men who are concerned that the vaccine might affect their sexual performance, which is a message we get consistently. And that's proven incredibly popular. The people, I'm not sure people are aware of this cartoon series, these animated series. It's created by a company called Rams Comics. They have had well over 80 million views on YouTube for their various projects. And these were used in an effort to sort of appeal to people's different, to make, if you make people laugh, then often they can be a little bit more receptive to your message. It's in no way an effort to trivialize the message, but to find a different way for people to get into the conversation about the vaccine. Again, all of these materials are freely available if anybody wants them. So then just to explain a bit about how the communications is actually working, we've got the risk communication and community engagement technical working group, which is run by the National Department of Health and is reproduced at provincial levels. And one of the core functions includes managing demand acceleration. And that's and under these two structures, there's ongoing development and implementation of communication plans for vaccine uptake and continued COVID prevention communication. Also very, very importantly, there's obviously communication engagement, which is working with CBOs, religious organizations, etc. And then there's what we call social listening, which is a group that meets every Friday. And we try and hear from as wide a group as possible what people are actually saying about the vaccine, what people are saying about the experience of COVID, what people are saying about the experience of the facilities. And we try and then recommend what the communication agenda should be for that week. One of our core, very important areas of information is the call center, where we hear what people have been asking about and talking about, as well as social media. So at the moment, the current campaigns end at the end of this month, and then there'll be a new cycle of campaigns. And as we said, all of the objectives of the campaigns are to encourage vaccine take-up through social modeling and vaccine information. And that includes Nogo Mashaba, who's the animation, which has been on TV, digital, and community radio. Keredi, which has been on TV, radio, and social media. We've had our WhatsApp line and Ask a Doctor. Let's go to the next slide. Okay, thank you very much. I hope that was clear.
Thank you very much, Brenda, much appreciated. So now we're moving to the last part for today's session, which is actually chapter 9 in the field guide. But because it also has to do with the administration processes of the vaccination program rather than the clinical processes, we thought to combine it with the sessions that we've already had. This presentation will be done by Alka and Mr. Yash from the SCTA. Alka, when you're ready, I'll give over to you.
Thanks very much, and good evening, colleagues. Thank you for the opportunity. So the first thing we're going to discuss, well, that I'm going to present on is monitoring and evaluation. So what we use monitoring data for on the vaccine program is, well, some of the things is just in terms of actual vaccine stock and stockouts at different sites at the district and provincial levels. And we monitor the levels and also equity in vaccine distribution and accessibility. So are people at all points within a province or indeed within the wider country able to access the vaccination points, different types of vaccines that are used, and then integrating public and private sector data, looking at uptake and coverage for the target populations in various settings. So for example, we look at things called congregate settings, such as the Department of Correctional Services. And then monitoring trends of certain indicators over time and comparing the performance at different levels. So at the actual vaccine site level, at the district level, and at the provincial level. Can we move to the next slide, please? Thanks. So the focus, what I'm going to focus on in this section is the difference between strategic information and monitoring and evaluation, and specifically why this can be useful, using these techniques can be useful to you. So monitoring and evaluation, the key difference is that monitoring and evaluation is used at an operational level, and these tools and techniques look at specific performance indicators at operational level. So on vaccine sites, carrying out the actual vaccine activities and collecting that data in the field. So very much on at the point of care. And then looking at strategic information. So this is more this is used more for decision-making, and it's used, so this is taking that data and the data from the vaccinations themselves, such as on the EVDS, and turning it into data products. So this would be something like a dashboard, for example, the dashboard that is used on the South African coronavirus website. And then people at a planning and strategic decision-making level would use this to then design the program, for example, and then it would be rolled out at an operational level, and that's where the monitoring and evaluation takes place. Some of the tools that are used for strategic information when doing the data analytics is that we use huge lakes of data. They're called data lakes, and we apply certain techniques such as machine learning and artificial intelligence to mine the data, if you like, and provide these key insights. So I think we've covered most of that. Maybe just at the end, sorry, if you can just go ahead to the next slide. Thank you. So what is the significance? I think the summary here, this is the most important part, is that strategic information is used to inform new policies and work across programs. And it's exactly what the name implies, is that you're turning data into information that can be used to design strategies and make strategic interventions. Okay, whereas monitoring and evaluation, you would use that to track what's going on the ground, like how well is that being implemented, and what are, how could you do things differently, or where are the stumbling blocks? Next slide, please. Okay, I'm not going to go through this, through the actual EVDS ecosystem, but perhaps just look at the data and information section. So what's important here is that we're actually using the data that's derived from the activities, the vaccination site activities, and we are governing that data, ensuring that the data is complete, that it is of a certain quality, so the data is cleaned, that of course we run the data analytics and then provide the visualization. Now, one of the major tools in the vaccine program that is used for data visualization and that is available at national, provincial and district level is the single sign-on, which gives access to raw data reports and dashboards. So if that is an area that you are particularly affects your working area, then that is something you would want to look at. And some of those reports are automated as well, so they can be sent to various officials. And we are trying to push the data demand for those dashboards. Next slide, please. Okay, so what can you find on EVDS, on the online EVDS? So a basic report that's available on the system that provides information to the number of vaccinations. So when you're looking at, when you logged in as a site administrator, you can go to the report section of the can we just, excuse me. Can we go to the next slide? I think that shows the actual screen grab. Yeah, okay, so the facility report. These are reports that you can see at your facility. You just select the report button at the top right hand of the screen, and you'll be able to see on your screen, you can select a date range. You don't have to, but you can select one. And the information you get there will be when the report is generated, the facility name, as well as where it's linked. So the sub-district, the province, and if it's a vaccine site that's an outreach site, even the facility that it's linked to, the parent site that it's linked to. And this is true for both private and public sites. Wherever the EVDS is being used on site, this is available. So this is something that's very useful for site managers and for even for facility managers now that the vaccine program is being integrated into normal healthcare services. And it will give you the total number of vaccinations for the period that you've requested the report for. So you can also, at the top of the report, below the delete reports button, you can either copy the screen or, and when I say the screen, I mean the report section of the screen, or you can download it as an Excel file, as a CSV or comma separated values file, or as a PDF, or just print it. So those are very useful. It's nice to download the report if you've got a number of pages. So if you've got lots and lots of results, then it's very nice to be able to download it. You can't dive into any further level of data. So you can't see, for example, line list data that you wouldn't be able to. And when I say line list, I mean patient level data. Next slide, please. So the reports that the EVDS produces that are the EVDS data use. So this is the data that's generated not only at the site, but through an entire district, province, and right up to the national level. So these reports are used as dashboards through the online NDOH Information Center. So that is what I was talking about when I spoke about strategic information. However, you can also download, if you have access to those dashboards, you can also download the detailed data as an Excel file. that would give you, you can drill right down to the, for example, the number of females who were vaccinated with Pfizer within a certain date range at a specific vaccination site. So that's the level you can drill down to, and that's the kind of thing that might be useful at a district or provincial level. But you can also look at the big picture, and those are the dashboards. So you can see some of these dashboards are available on the SA Coronavirus website, and I really encourage you to go and look at them regularly to see what's going on with the program. And some of the data there is also not only about vaccination, but also about hospitalization that's for COVID-19 patients. And then access to this, and just a note that there's no personalized data. So this is compliance with the POPI Act. You won't be able to get any individual level data. Access is facilitated through the provincial EVDS lead. So do contact through the correct channels in your district and province if you need access to the SSO, and they will facilitate it with national. Next slide, please. And these are the various dashboards that are available. So and we call them themes on the single sign-on, the SSO. So you would log in, and then you would see, you could select either the COVID-19 infections, hospitalizations, vaccinations, and then there's vaccination strategic information and vaccination management. But as someone at provincial level or district level or sub-district level even, you would be more interested in the vaccinations. So that's the actual data that will take you through to site level, and it really has some lovely dashboards, very useful. Okay, next slide, please. Okay, so again, this is the external data that I was, dashboard that I was talking about, and there's the link. So if you go to the SA coronavirus.co.za website, you just have to select latest vaccine statistics from the menu, and it will take you to the dashboards, and then you can go through the different pages on the dashboard. And that will give you access, and this data is derived from the number of vaccinations administered in the last 24 hours, but it will also give you a comprehensive overview of the vaccination program. So all of them to date. It will also summarize by vaccine type and dose, coverage per cohort. So that is for each age group. And because remember, as was discussed before, the different age cohorts were the vaccination open to the different age cohorts at different times last year. Then of course the 12 to 17 years. So I think there's at least one page with significant, with very specific information around this age cohort, the 12 to 17. But the rest of the dashboard is only from 18 plus. And the total number of individuals vaccinated, okay, that's already. And then what's also very interesting is looking at the booster vaccination summary, because I think what that tells us is how many people have had their primary vaccination schedule and are still coming back for their, and are then coming back for their boosters. And there's also information around the immunocompromised vaccinations. So just a reminder that that is immunocompromised, completing their primary schedule, and then they received an opportunity to have an additional dose, and after that they can also receive a booster. So there's information or nice graphs available for visualize for that. And then there's and I think this is a very interesting page where you can look at some graphs showing hospital admissions by vaccination status. And this is one of the things that can be very helpful in informing any discussions you might have, with observing the guidelines that were given to you earlier, but this can also be a communication tool. So just to guide to give a gentle nudge around hospital admissions and how vaccination can protect people from serious COVID-19 illness. Next slide, please. So there's also an external data access. So this is very much a data dump. This is for novice and advanced users. And this platform is available to users through the public dashboard. I mean, data from the public dashboard is made available through this platform. So that project has now been completed, but you can, it's sometimes more easy to, it's more user-friendly, if you like. It's easier to consume the information products, the actual data products that are available through the single sign-on, or if you don't have access to that, the South African coronavirus website. Next slide, please. Okay, so these are reports that are available on the SVS COVID portal, but I'm going to hand over to my colleagues in the SVS team. I think it might be Monsonique who will take over from me here. Thank you.
Thank you, Olga. It's actually Yash. Yash, if you're ready, you can start. Thank you.
Thank you very much, and thanks for giving me the opportunity to present on this. So as most of you do know, like, the COVID vaccines are reported on SVS devices at facility level. And in order to visualize this information and to analyze it, they've been given, we also have access to the SVS COVID-19 web portal. And as part of the SVS COVID-19 web portal, we have access to a certain number of reports. All these reports that I'm taking you through now, they all have a download button on the bottom left corner, so you can download them and analyze them in Microsoft Excel. They'll be in CSV format, and that allows you to just do a little bit more advanced analytics wherever you need to. The first reports, well, the first two reports that are available are the public sector reporting and private sector reporting. These are an overview of the percentage of facilities in real time that have reported within a certain province, district, or sub-district versus the facilities that have not reported. It's also important to note that these reports are live. Therefore, if you check compliance earlier on in the day, it might be very low. But as time progresses through the day and more facilities have reported, you'll see that number go up. So if you check this report in the later afternoon, you'd have a higher reporting compliance than if you did in the morning. And another aspect of these reports is that it also gives you an indication of which facilities are experiencing stockouts. So that's very simple. And the second one is called the geospatial stockout map. This is quite interesting. It shows you a visual representation of which facilities have stockouts, as well as a visual indicator of the extent of the stockouts. And this is depicted on an actual map of the country, and it works for both public and private facilities. And the third one is a stock availability report. And this report basically allows the users to view the quantity of stock available for an item per district, sub-district, or facility. And the fourth one is the facility stock updates. So this report will show you all the updates made by users at facilities and exactly what they input on the SVS device. And the info you get here is the stock on hand, the stock received, the stock lost, the stock issued, and the stock transferred, as well as the expiry dates for the items reported by the facilities. And those reports can also be used to view the full history of stock updates. So you can view the last update that the facility has done, but also you can go further than that and view the complete history of the facility. So I'm not sure if you can see at the bottom here, but that's just an excerpt of the report and shows you the information that you can get from this report. So you'll see it shows you the date and time it was updated, the date that the device itself is synced, shows you the stock category and the item name of the product that's the update was for, the inventory codes and the VEN status. And then all those data fields are mentioned just now, as well as the expiry dates, and for which facility the update was done for, as well as the geographic information for it, and if it was a public sector site or private sector, and if it's a private sector site, which organization it was part of. Next slide, please. Then the other reports is a stockout reasons report. So in the case where a facility experiences stockouts, this report will show you the status of the stockout, as well as the reason that they've captured at the facility. This report will also show you if there's an alternative available that can be used instead of the item that is currently stocked out. That's probably more applicable to ancillaries than the actual vaccine, but it does give you that, that option. Then you also have the stock lost reasons report, and that provides quantities of stock lost with the accompanying reasons per facility per item as captured by the site staff. And here you'll see an example of that below. You'll see that and that yellow block, it shows you why the items were lost. So for instance, here's one was discarded due to heat exposure, and the other was a vial breakage. The second to last report is the history of weekly compliance for the current week. This is very similar to the next one, but it shows you for the week that you're in, on which days a facility in question has reported. And it shows you which haven't reported as well. It's just a true and false for each day of the week, and that's depicted on the dashboard, as you can see in the bottom screenshot, and the history of weekly compliance for the previous weeks. Again, very similar, but you can go back further in the date range and see for a given week who has reported and who has not reported. So that shows you, if you're looking at the screenshot for facility and for the days of the week, it shows you true or false whether they have reported for that week, as well as the weekend, and weekly reporting average as a percentage on the far right. Thank you very much. And yeah, so to access this, you'll do it through the SVS COVID-19 web portal. And to access it, you go to, where's the URL? Sorry. To log in access data, contact the SVS NDOH. Oh, thank you very much. Right in front of me. It's https //COVID-19 vaccines.za.app. And to log in and access data, contact the SVS NDOH project manager and request access through the provincial SVS champion or group lead. And you'll have to sign a confidentiality agreement and return that. And you'll have registration credentials sent to you via SMS or email. Next slide, please. Thank you. Back to you, Marianne.
Yes, thank you very much. So Dr. Lesego, we are done with the initial part of the training, and we can open up for live questions if there's any hands. Do you want to facilitate the unmuting of participants? While you're doing that, I will just would like to appreciate, give special appreciation to all our colleagues at the National Department of Health that assisted with the development of the content, and then also our support partners, including CHAI, CSIR, the MRC, SMU, and SAVIC, CHAPS, UNICEF, SCTA, WHO, and the DG Murray Trust for the design of our document. So we can go back to the questions if you can facilitate the unmuting of participants. Thanks.
All right, we have Nobomi. Maybe let's start with Elvis. We'll come back to Nobomi. Elvis, you may unmute your mic and ask your question. Thank you.
Hi, afternoon or evening rather. I just want to find out, sometime during the beginning, I think it was at 21, when we started with this vaccination, we had to attend these courses via the Knowledge Hub. But I mean, I'm a nurse practitioner myself. I do have a facility. I even went to the extent of even purchasing, a vaccine-specific fridge and all that. But what is quite interesting is that now, much as one had to register on this MFL stuff, you know, as a representative and whatever, which I think was the first step, that never materialized. But funny enough, one still gets all these updates about training and all that, but the one is not even registered on the system. So I don't know whether if you are a small private practice, whether it's possible that one can participate in this program, because I had thought that there was a need to get as many hands on deck as possible to help with, you know, the vaccinations and all that.
Okay. Thank you, Elvis. Maybe let's try and take the second hand before we can respond. Nobom Nini, you may unmute.
Okay, thank you very much, Dr. Mawela. Good evening, colleagues. Nobom, one of the Unjani nurses in the Eastern Cape. I wanted to check, since we do have the Section 22A, are we still expected again to reapply for this immunization if we happen to immunize, to vaccinate?
Okay, thank you. Marion, how many hands can I take? Should I take more hands? And maybe. Yeah.
Okay, thanks. Let's maybe start with these two.
Okay, sure.
With these two hands, I think for nurse practitioners, it's actually far easier for a nurse practitioner to get a permit and to be part of the vaccination program, because they have Section 22A15 permits that is issued by the Department of Health already. So the Department of Health can serve as the curator within their process. But, you know, it's following the simple MFL process that has been described, and I can maybe ask Pietro to give us more insight in that. So for nurse practitioners, it's quite easy to participate in the EPI, in the COVID-19 program. The challenges that we have is actually with GPs, and the reason why we have challenges with GPs is because they are not registering. When they register with their Health Professions Council, they are registered under a practice number and not under a facility with a specific address. So it's very difficult to validate that that facility actually exists as it is then described by the GPs. I'm not sure, Pietro, do you want to add anything on the MFL process? I think both within the implementation guide and also on the links available for the MFL, there is training being provided, and it's and the process is quite clear if you follow the process as it is described. Pietro, if you want to add something, thanks.
Yeah, no, agreed. Good evening, colleagues. Yeah, definitely agreed, Marion. And I think if the specific colleague, I will put the email address that is also provided during the training on the chat. So if you can just send us the email with the details of the challenge that you're experiencing, then we can look into it for you.
Okay. Okay. Thanks for that. Kutele Mieza, you may unmute. Kutele, your hand is up. You may unmute. All right. I think Kutele, maybe it's a hand that was raised by mistakes. Colleagues, you may continue to raise your hands. I'm not sure from the questions that were asked in the Q&A if there's one or two specific things that we need to address to all the health workers based on the questions we have responded to. Any key themes? Yeah, thanks.
Yeah, thanks, Lesego. There was a lot of questions about the Knowledge Hub. So maybe it's worthwhile that we just brief the private sector on what the Knowledge Hub is. So the Knowledge Hub is the training platform that is used by the National Department of Health. It contains all of our updated guidelines. So it's not specific for COVID-19, although you will find all updated guidelines relating to COVID-19 on the Knowledge Hub. What you would do is you would register yourself. It is a zero-based platform, so there's no cost involved to register. There's no cost to participate in any of the CPDs, in any of the live trainings, or in downloading any of the documents on the Knowledge Hub. Everything is free to healthcare workers. Regular trainings are being provided, whether that is from HIV treatment, non-communicable diseases, TB, treatment of COVID-19, prevention of COVID-19, management of COVID-19 sites. I mean, really, it's an excellent platform. And a lot of these training sessions are actually linked to CPDs as well. So it's a great platform to ensure that you get the necessary CPDs that you need to stay updated. And you will then always be updated in terms of how the Knowledge Hub actually works. So I've given you the links for the COVID-19 specific training that is available on the Knowledge Hub, and the name of the training that you can attend. The training for vaccinators is about, in total, 3.5 hours training. It's 7 modules, of which 1 module is on ethics, and you can get an ethics CPD point, which I know that healthcare workers are, especially doctors, are always looking for. And it also contains the different modules of training. So the training for vaccinators, even if you're a nurse practitioner and you are currently providing vaccination services, are still required if you want to participate in the program. And that is largely because of the way that the program has been rolled out to ensure that we have equitable access throughout the private and public sector. And regardless whether a person is accessing the vaccination program in the public sector or they are accessing the vaccination program in the private sector, regardless if they have a medical scheme or they don't have a medical scheme, the service that they get is the same, and the way the service is provided is the same. So the same tools are being used. The vaccination services are recorded on EVDS. The site is on the MFL. The site has a permit, meaning that it meets the minimum requirements for that site to be a vaccination site, which then in return ensures that the vaccines that are provided at that site is safe and potent. We also know that these vaccines, the COVID-19 vaccines, there's a pharmacovigilance requirement. So we monitor the vaccine safety of these vaccines throughout our program. And, you know, in the session that we're having tomorrow, there's a lot of information about vaccine safety surveillance as well, which you will attend tomorrow and you will get that information. But what is also important is that even after we have done pharmacovigilance activities and we've monitored the safeties of these vaccines, the National Department of Health has established a no-fault compensation scheme. And to ensure that the service that we are providing is of high standard, and therefore the risk of you know, compensating events that might happen within the vaccination program is not, you know, really on the Department of Health, but rather that all of our healthcare practitioners are providing good quality health services. It is important that we have compliance. I see that we have 4 questions in the chat. So let's take the question regarding the Section 22A15 permit. Who can I contact at the National Department of Health and Mpumalanga concerning the Section 22A15 permit? And this is from Joyce Mabuza. Maybe we can ask Joyce to unmute so that we can just understand what her challenge is to advise her on how to proceed.
Okay. Joyce, if you can, let me see if I can find Joyce Mabuza. All right, I think I found it. Joyce, I've allowed you to talk. May you kindly unmute your mic and maybe ask your question? Yes.
Good evening, professors. Thank you for such a lovely and informative session. In Mpumalanga, as private nurses, we are experiencing problem to get those permits so that we can manage to have the vaccines and also to do all the immunization for children. We don't know whom to contact because all the other colleagues of ours at the SPNP, they do get the permits in Joburg, Limpopo, and other provinces. But in Mpumalanga, we are experiencing a huge problem. We don't know whom to contact and who can assist us.
Okay, Joyce, so let me understand, is your question specifically to the EPI vaccination program or to the COVID-19 vaccination program?
The COVID-19, when it started, mostly of the private nurses, I encouraged them that we do the vaccination certification. And then when we applied, none of us were granted that opportunity to vaccinate or to have the vaccine. At the end, we went to help other companies that were from Joburg coming to vaccinate in Mpumalanga.
Okay, do you currently have a Section 22A15 permit?
No, I don't.
Okay, so as I've indicated, the process starts with registering on the MFL. So that is the
Yes.
very first process. And if you register on the MFL, I'm sure that you did see the link in the chat. That's how you would
Yes,
start the
yes.
process. Once you have registered your organization, then you will receive, and you've activated your vaccination services, you will receive a link from the Pharmacy Council.
Okay.
You then fill in the form that is attached to that link, and that would be sent back to the council, which then comes to the Department of Health. The Department of Health then reviews your application, and then the permit is issued. And once the permit is issued, you can open an account with the distributors to procure the vaccine and then be part of the vaccination program.
Thank you so much. I'll redo that because last time I tried to follow it, they sent me the link, but I didn't get any response. I'll retry and apply again.
Okay, and if you do have any questions, on the link that is sent to you, there is an email address where you can send any comments or questions or concerns that is being used. So please send, if you have any further challenges, send it to that NDOH email. I think it's NDOH permits, I think, but I don't have the exact name of the email address, but I know that they will answer your question there. Thanks.
Thank you so much.
Okay, I was trying to search for the MFL link. If you can reshare it on the chat.
It's currently on the chat. I did see it. It was shared by Pietru.
Okay.
And she also shared the training times for the MFL training.
Yes, every second Tuesday. Okay.
Yes.
Okay.
Okay, good.
Perfect.
Okay, so there's a question. Can I have the vaccine safety link? Is this to report an adverse event on the MedSafety app? That will be discussed tomorrow. There is a module, I think it's module 4, as part of the vaccinator training that also go into depth to describe the vaccine safety surveillance process. For now, I would get you the link to the MedSafety app, and I will try and paste it in here. Just give me a minute. We'll do that now. And then the top question, considering the availability of COVID, I'm sure you're talking about COVID vaccines, there might be requests for other vaccines. How do we handle this? So are we talking about other vaccines as in EPI vaccines, flu vaccines? So maybe Ntabi Singh can maybe just pose a question live as well. Also, our facility was assessed and approved, but the process was died quietly because the community, because we are community-based and we thought that we would make a difference. Okay, Ntabi Singh, please, you're welcome to pose your question live while I search for the MedSafety link to give to Boitumelo.
Good evening. Thanks very much for a great presentation. Yes, we based in Sidibeng in Gauteng, and when the beginning of the talks of the COVID came through, we thought we were best suited because we are right inside the community, serving one township, which is Buipatong, as well as Vanderbijl Park, and the officials from the region came and they assessed us and they said yes, no, they would approve, but then we couldn't, the process just stopped at that. And also there's always a query in terms of, doctor, can we get some more vaccines? Can we bring our children and so on? And that actually is a problem. But
we are still very keen to be supportive on the COVID uptake, because this is viewed as very important. But then there would be, some questions based on other vaccines as well, which we are willing and are able to. But then I understand that if we get to the MFL, then for registration, we will take that route and retry again, because now we're dealing with the local people there, and maybe if we do it via the MFL, we will try that. We will make that attempt again. I hope I'm clear.
Thank you very much, Ntabiseng. Yes, that's very clear. I think that we are going to have an engagement between the public and private sector in a few months, especially to discuss the importance of EPI vaccines specifically. We want to ensure, just like some other provinces, like the Western Cape and the Free State province, where some of the vaccines from the public sector are shared with the private sector. The private sector is then asking a minimal fee for the administration of the vaccines. They may not charge for the actual vaccines, and then they share the data back to the National Department of Health or to the provinces, so that we can improve access to vaccines overall. So we are working on a process to make it easier for the private sector to participate in general in the public sector immunization programs, noting that vaccines are quite expensive in the private sector, where your 6 months vaccination can be up to 3,000 Rand, which is very expensive, even for people that have a medical scheme. So we are working on facilitating that process. As I understand, it seems that you wanted to access vaccines from the public sector for COVID-19 and then use them in your private practice, which is allowed. The challenge is with the compensation of the administration fee, and I'm sure that that is why the process has actually died quietly, as you described it. I would recommend that you follow the MFL process. This will then allow you to procure the vaccines. And once you have procured the vaccines, you can provide the service at your site. An alternative option for a GP that should definitely be considered is linking up with pharmacies in your area, where you can actually receive some of the vaccines from the pharmacies, provide the services, and you would also then be able to access smaller pack sizes. I see that there is a comment: if a 12-year-old child presents for TD, can we also jointly give the COVID-19 vaccine? Yes, COVID-19 vaccines may be administered with any other vaccine at the same time. But if you are administering the COVID-19 vaccine, we prefer that you vaccinate and indicate on the vaccination card that you have provided the COVID-19 vaccine on the left arm, if possible. And that's just really to monitor adverse events if they do occur. Any other questions?
No, I don't think we have any questions. We don't have any hands. It seems like, I think Nobomi, you wanted to have a follow-up question. Can I just check?
Thank you so much, Dr. Mawela. No, I wanted to comment on the Knowledge Hub facility list, because the Unjani clinics doesn't appear there, of which were about 111 facilities by now in South Africa. So can we be added as well as Unjani clinics on the facility list?
Sure, I'm going to
not
ask
as other.
I'm going to ask that you submit that request to info@knowledgehub.org.za. I don't actually work in the Knowledge Hub section, but I'm sure that they would be able to facilitate you. Some of the larger other medical groups are already included in there. So there's
I've submitted that long ago, but I'll again resubmit. I requested, I submitted that request long ago.
Sure, thanks.
Okay.
So there's a question of there any side effects to mixing Pfizer and Janssen vaccine? This will also be discussed tomorrow. There is an updated schedule where the vaccines may be used interchangeably with no significant change in the safety profile of the vaccines. Another question: how can we inform the community that they can vaccinate without documentation? That is a very excellent question as well. This will also be addressed tomorrow. There's quite a a big section addressing vaccinating undocumented individuals, which will be discussed tomorrow. Some of the communication that might be required is really the way that you invite these individuals to get vaccinated. Unfortunately, vaccinating of undocumented individuals is limited to the public sector. But it's very clear that you should create a safe environment where they can access the vaccine.
Yep, I see Techno, it's not a name, I think it's the name of the phone. Techno Spark 6, would you like to make your comment? Techno Spark 6? All right. I think Tabiseng and Joyce, we've already heard from them. I think that should be fine. Yeah, we don't have any other hands, Marion. I think maybe we can start there to call it a day. I don't know from your side if there's
that's fine. So tomorrow's section will then be on effective vaccine management. We'll touch on how the vaccine should be distributed, stored, used within your facility, and then how to minimize vaccine wastage while reaching the optimal number of people within your community. Then we'll go through the user journey, and as I've indicated, one of the requirements of the program is to ensure that there's a standard user journey, whether you access the vaccine at different vaccination sites, whether you're private or public sector, it doesn't matter. We want to ensure high quality services are provided to all. And then lastly, we will address vaccine safety surveillance in South Africa. And we're looking forward to seeing you again tomorrow.